Thank you, Governor. Thank you very much. Governor McKee, thank you very much. I'm going to let Secretary Raimondo know that you beat her to the punch in getting me something from Rhode Island. So I think we've agreed, because time is short, we're going to go straight to Q&A. And so the 4, 5, 6 of us, 2, 4, 6 of us will be available to answer any questions from the press. So please go right ahead.
So we have Pat with the Coalition Radio Network.
Yes. Mr. Secretary, first of all, thanks again for meeting with Tina Peterson of RAMP this morning. Rhode Island was the first in the nation this week, and Governor McKee signed into law legislation that creates harm reduction center pilot program here in Rhode Island. I wonder what your thoughts are on harm reduction, the opioid epidemic, and recovery in general.
First, on the question, I will tell you that, and I suspect all of us would, if we have a chance to say something, we'll probably say the same thing. We need to tackle this. When 93,000 Americans die in 1 year from drug overdose, we've got a problem. And I know in Rhode Island, opioids have hit hard. My state of California hit hard. I know there are a number of efforts underway to get a lot of the folks who bear some responsibility, the manufacturers, the distributors, to come to the table so we can start really dealing with this. And President Biden has made a commitment that we're going to do everything we can to support the local efforts to address the the substance use disorders that are plaguing too many of our communities. And so if you've got a program that's working locally, we want to be a good partner to see if we can support as well.
Is the federal government ready to, if you will, look aside from the DEA scheduling issues on some of these narcotics and allow these harm reduction centers to grow, enforce, and to save our nation's folks in recovery?
So when you talk about how some of these drugs are categorized, it's
right.
not a simple thing of just turning a light switch on and changing how you do it. Mm-hmm. And so it has to go through a regulatory process. And so that is under consideration. And so what I can tell you is that we want to learn from those on the ground the best practices that are working, and we want to be supportive. And if the president's proposals on the American Rescue Plan can be followed with now the work that's being done in Congress to pass an infrastructure bill, and the American Families Plan and American Jobs Plan, as it's going to be packaged in the reconciliation package, we'll actually be able to give local community leaders the resources they need to get this done. Let me see if some of my colleagues want to, governors and the senators and representatives want to say something.
I just want to just weigh in on that, just for your information, right? So General Assembly did pass to create a center to help in terms of the opioid issues, and so we've passed that. We've got a committee that we're going to be putting together. We're going to determine what it might look like, and certainly going to be working with your office on that. But I'll echo with you that as a former mayor, somebody who's been involved with youth work for too many years to actually tell you how long it's been, we know that families have been impacted. I tell the story about when I was as Lieutenant Governor trying to help the fishermen in Westerly to try to get them to be able to sell their product as they come off their boats. And we're going to meet with many of the fishermen in my office. And one of the person who was leading the charge sent a letter, and his son died of an overdose the night before. So this thing is very important, and we're willing to, it's a 2-year pilot. We're willing to be very intentional about it, but very smart about how we do it. So we'd love to be able to kind of work with your office as that unfolds, and making sure that we're doing everything we can to make it happen. One other thing I'll let you know that as Lieutenant Governor, I've also helped assemble over 39 communities to do a lawsuit on the opioid manufacturers and distributors, and we're starting to see results from that, and we're going to have several millions of dollars, tens of millions of dollars that are going to be coming into Rhode Island as a direct result of that effort by our local municipalities. And as a former mayor, we were able to bring that together along with our Attorney General too. So we're going to, that number is staggering when I read that in the paper the other day, 93,000 deaths during the pandemic. Rhode Island had about 370, I think, in that range, and that's right in that range, far too many, more than we had the previous year. And just like that gentleman that was a fisherman down in Westerly, every one of our kids is important to us, right? So we need to do everything we can to address that.
Let's see if my Senate and House colleagues have something they'd like to add. Can you please say hello to your Attorney General, good friend?
We have,
Secretary,
Yes.
Richard Asinof from Convergence, Rhode Island. You can hear me?
But Richard, are you with press?
Yes, I am the editor and publisher of Convergence, Rhode Island.
Okay.
It's a digital news platform, been publishing for 8 years. And I know all the congressional delegation there. They've all talked with me. The research that's been done on claims has shown that the major cause in the rise in healthcare costs in Rhode Island in the last 2 years is because of retail pharmacy prices across the board. It's a leading driver. Somewhat surprising, but that's what the analysis of the claims data has shown. So from your perspective, what can be done to better regulate drug costs, particularly as it affects consumers?
Wow, we could spend all day on that one because there are a number of ideas that are underway, and I think the members in the House and the Senate could probably give us a sense as to whether or not anything in the package will help us, but anything from negotiating drug prices so that the government is getting the best deal it can, importing drugs from places like Canada where the same drug costs a lot less. There are efforts to, whether it's on the rebate program that's available, so that we make sure that the best price is being afforded to those in the health centers and so forth. There are any number of ways that we could try to tackle the price of drugs. The rebate program within Medicaid itself. And so we're looking at what we can do. We have some authority already within the administration to take some action, but we really do need Congress's help to do, get it over the moon. And that's where we're hoping that, along with some of the proposals that will help us with our infrastructure on the healthcare side, we'll be able to tackle drug pricing, because there's no doubt that Americans are paying way too much for their prescription medicine.
Antonia, Providence Journal.
Hi, Secretary. You've been earlier today promoting the American Families Plan, and clearly you've got a lot of support from the congressional delegation here. So why did you think it was important to come to Rhode Island today, and what else is on your agenda for while you're in the state?
Well, it's always good to take a look at successes. And if you want to talk success, you got to come to Rhode Island. And we would like to make sure that what Rhode Island has learned, that we use to take best practices from and be able to implement far beyond the borders of Rhode Island. At the same time, it's always nice to see four good buddies who have done some great stuff in Congress over the years, who keep me very busy, but obviously for the right reasons. You all have succeeded in ways that others in this country have not. You're also taking on some innovative programs, as you just mentioned, and I think that's great. I think your size helps you jump higher than most would expect. And so it is good that Rhode Island punches way above its weight class. And I hope you will continue to do that, because when you do, we all learn from it.
Ryan, Channel 12, last question.
Hi, Secretary. My question is, what is your advice on getting vaccines into low-vaccinated communities?
Ooh, and the experts are really right here. But what I will say is this. I hope that what we can do now, and I suspect some of the folks in the health centers are doing this, those who work in healthcare, are reaching out to all those trusted voices. It could be your pastor, it could be your primary care physician, it could be your wrestling coach. Whoever it is, we hope we can enlist you to help us reach those families that have not yet been fully vaccinated, because there's a lot of disinformation out there. And the last thing we need is for you to go to the hospital or for you to join the more than 600,000 Americans who have died. When you realize that today in America, if you die today, that means you've not been vaccinated, because more than 99% of Americans who are dying from COVID today are unvaccinated. I don't know what the disinformation campaigns out there are saying, but that's a fact we can't change, because those folks who died cannot come back and live out their full life. And if if I were to tell you, when you get in your car, are you gonna buckle up? 90% of Americans buckle up today. Now, 60 years ago, it was tough to convince Americans they should buckle up because it was new back then. Today, 9 of every 10 Americans buckles up. We still have to get to that 1 in 10 who doesn't, but 90% of Americans buckle up. Guess what? Because people buckle up, about 45% of Americans live in some of these accidents that would have died. 45%. I just told you that 99% of people who aren't getting vaccinated are the folks who are dying of COVID. And so if you think it's a good idea to buckle up and it improves your chances of surviving by about 45%, then why would you not vaccinate if you know that it improves your chances, if you're one of those COVID patients in the hospital, of surviving? And so I don't know what more we can say to you. And I know that the 4 members in your congressional delegation have worked very hard. And I know everybody in this room who's involved in healthcare has tried everything they can. But we just need to reach it because we don't need you to die. Your children don't need you to die. Your grandparents want you to live. They want to see you grow up and be prosperous. Help us help you.
Thank you. That's it for the
Uh,
first event, really.
Well done.
Thank you.